Hey there. Welcome to Moot's latest series, Traumas and Inner Voices. In this 7-day series, we'll be delving into the fascinating world of past trauma and negative inner voices. In today's video, we will explore coping strategies, especially the effects of the unhealthy ones. In the coming days, we'll explore expressive arts therapy, understanding complex trauma, how trauma affects brain development and functioning, and much more. So, if you're ready to unlock the secrets of past trauma and take control of your inner dialogue, then make sure to hit that subscribe button and turn on notifications so you don't miss a single episode. Are you ready? Coping strategies are techniques, actions, or behaviors that individuals use to manage and reduce the impact of stressors, challenges, and negative emotions they experience in their life. Coping strategies can be both healthy and unhealthy, and can vary depending on the individual, the situation, and the severity of the stressor. Healthy coping strategies are those that promote well-being and positive mental health outcomes. These strategies can help individuals to manage stressors and difficult emotions without causing harm to themselves or others. Examples of healthy coping strategies are mindfulness and relaxation, exercise, social support, cognitive behavioral strategies, and self-care. Unhealthy coping strategies, on the other hand, are those that can cause harm to oneself or others in the short or long term. To understand these strategies and its effects better, we'll zoom in on 3 of them now. First, substance abuse. Substance abuse is the act of using drugs or alcohol in a way that causes harm to one's physical and mental health. It is often used as a coping mechanism to deal with stress or negative emotions. However, using substances to cope can lead to addiction, which is a chronic and relapsing brain disease characterized by compulsive drug seeking and use despite harmful consequences. People may turn to substances such as alcohol, marijuana, prescription drugs, or illegal drugs to cope with difficult situations, such as relationship problems, financial stress, or trauma. While using substances may provide temporary relief from negative emotions, it can also lead to a cycle of addiction that is difficult to break. Substance abuse can have serious consequences on an individual's physical and mental health. Chronic substance use can damage vital organs such as the liver, heart, and brain. It can also lead to mental health problems such as anxiety, depression, and psychosis. Substance abuse can also negatively impact personal relationships, work performance, and overall quality of life. Treatment for substance abuse typically involves a combination of therapy, medication, and support groups. It is important for individuals struggling with substance abuse to seek help from trained professionals who can provide individualized care and support. By addressing the underlying issues that led to substance abuse and developing healthy coping strategies, individuals can overcome addiction and lead a fulfilling life in recovery. Second, avoidance. Avoidance is a coping strategy that involves trying to escape or avoid situations or emotions that are perceived as stressful or difficult. For example, someone who has a fear of public speaking may avoid speaking in public or attending events where they are required to speak in front of others. Similarly, someone who has experienced a traumatic event may avoid situations that remind them of the trauma, such as crowded places or certain smells. While avoidance may provide temporary relief from stress or anxiety, it can lead to increased anxiety and other mental health problems in the long run. Avoidance can lead to a sense of helplessness and a lack of control over one's life, as well as limiting one's opportunities for growth and learning. Additionally, avoidance can become a cycle, where the more someone avoids something, the more anxious they become about that thing. This can make it even more difficult to confront the stressor or difficult emotion in the future. It is important to note that there are times when avoidance can be a healthy coping strategy, such as when someone is in immediate danger or when it is not possible or safe to confront the stressor. However, when avoidance becomes a pattern of behavior and interferes with daily life, it may be necessary to seek professional help to develop more effective coping strategies. Third, self-harm. Self-harm is a maladaptive coping mechanism used by some individuals as a way to cope with intense emotional pain. Self-harm can involve a variety of behaviors such as cutting, burning, hitting, scratching, or other forms of self-injury. These behaviors may temporarily relieve the individual's emotional distress, but in the long term they can be harmful and even life-threatening. Self-harm is often a sign of underlying mental health issues such as depression, anxiety, or trauma. It may also be a way for individuals to cope with feelings of worthlessness, hopelessness, or a sense of being out of control. For some individuals, self-harm may become addictive and compulsive, leading to a cycle of negative emotions and behaviors. It is important to note that self-harm is not a healthy coping strategy and can cause physical harm, scars, infections, and other health issues. Seeking help from a mental health professional is crucial for individuals struggling with self-harm, as they can provide support and guidance on developing healthy coping strategies and addressing underlying mental health issues. To conclude on this, it's crucial for individuals to recognize the difference between healthy and unhealthy coping strategies and to seek support and help if they're struggling to cope with stressors or negative emotions. Coping strategies are an essential tool for managing life's challenges and promoting well-being, and developing healthy coping strategies can help individuals to live happier and more fulfilling lives. That's it for today. Thank you for watching Traumas and Inner Voices. We hope you enjoyed today's video and learned a lot about coping strategies and the related effects. In tomorrow's video, we'll dive deep into expressive arts therapy for trauma survivors. Do you need some inspiration? In the description of this video, we have listed some mental health essentials and inspirational books which could help you to start and continue your growth. And last but not least, are you already a moot? If not, then don't forget to like and subscribe to our YouTube channel to stay up to date on the rest of this series and of course all of our future content. We hope to see you tomorrow again. Have a wonderful day.